Good evening and welcome to IHW Council's special web series on women's health, start supporting treatment in assisted reproductive therapy. I'm Anisha Nayyar, your host for this show. This is an exclusive show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. We are currently seeing the second wave of COVID-19 outbreak in India a year after the first outbreak happened. This is just a reminder that we cannot put our guards down and we have to ensure masking, washing hands, and social distancing. This is also a reminder to put our health before anything else. The arrival of the vaccine, the start of the inoculation process, and the lessons from last year have brought hope to millions who want to stay safe and bring about perhaps a semblance to the pre corona days. But there are many others who find themselves in despair as some of their dreams have suffered a setback because of the many restrictions brought down because of the lockdown and the fear about COVID 19. I am talking about couples who dream about starting their family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many young couples have been facing. According to the Indian Society of Assisted Reproduction, the infertility rate currently in India is about 10 to 14% of the Indian population. The scenario is even worse for cities where every 1 out of 6 couples is impacted. Our show today is special as we're going to discuss all aspects related to fertility and IVF treatment. Bharat Serums and Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing, the treatment, and counseling. Now, Project START encourages couples to stay on course for their IVF treatment to achieve their goal of parenthood. Today on our show, we will be discussing understanding male infertility. Now, there may be many questions in your mind on what you should do to succeed in starting a family. Our show will help answer many of these questions as we have an expert joining us to help answer all your queries. Please welcome Dr. Arindam Rath, fertility physician and IVF consultant, Apollo Fertility, Kolkata. Thank you so much for joining us, Dr. Rath.
Thank you.
Now, before I begin our conversation, I would like to request all our viewers today to give us your feedback. And if you have any questions, start typing it in the comment box. This is your golden opportunity to get your questions answered by an expert who's joining us. And Dr. Rath will be happy to answer all your questions. We'll try to take as many as we can over the next 30 minutes. Do like and comment with your feedback and share this page with your friends or family members if you think that they will benefit from all the discussions that we do on health and well-being. So let's start, Dr. Rath. Now, when we talk about infertility, or usually what happens in our country, and this is perhaps the way our society's fabric is made, whenever, a couple is married for 5 years and there is no child, all the pointing fingers go to the wife. It is always assumed that there is something at fault with the woman, and it is the woman's inability to conceive. Is this still a predominant?
Yeah, it is. Yeah, actually very well said and very well pointed out, because this is still the stigma that our country, or maybe not only our country, the subcontinent, we are facing this. Because the issues, the first thing, the pointing finger goes to a woman, yes, because it is because of the woman. But now what we see that the male infertility also rise to almost 30 to 40% of the regular patients who are coming to my OPD. So out of which almost 30 to 40% are because of the male problem. So now many of the time the couple, when they go to a gynecologist or a doctor, the main first thing comes that they do a lot of tests for the woman, but we forget to do a test for the male, or most of the time the male will be reluctant to do a test in the initially. But my recommendation is, in the visit, the first visit itself, when you have started investigating the woman, the first thing that we should do a semen test for a husband, at least 3 to 4 days of abstinence. Like once they have discharged the sperm, and after that again 3 and 4 days gap is there, do a semen test and see the report. Once that report is fine and fair, so then we think of going for the woman for all the other tests or treatment or whatever it may be. So this is the basics requisite for any couple who are not able to conceive.
All right. But Dr. Rath, you said 30 to 40% of the cases are because of male infertility. What's really happening here? In your practice, are you seeing an increase in instances? Because
Yeah, yeah,
why should
drastically.
there be? Why should there
I
be
can
an increase in male
Yeah,
infertility?
I can tell you that 10 years back, the incidence was maybe around 10 to 20%. We not used to get so many patients of infertility, but now, I mean, presently it is rising. I mean, there are a lot of issues, the lifestyle factors, there will be the food habits, there is the environment factors, the temperature, then a lot of preservative that we use, the toxins, uses of laptops, a lot of things, the smoking, alcohol, a lot of things has been gone bad. So basically, it is rising in all these scenarios. And that's a stress factor also there at the same time. So together, the male infertility is on rise. Next, obviously, the patients used to have the sedentary lifestyle of the patient becoming more obesity, a lot of other things. Then a lot of drugs. I mean, previously the cancer rates were pretty low. I mean, now the cancer rates are having high. So with the medicines that they use, a lot of other medicine that has been used. So naturally, the male infertility is on very much rise. So there is a lot of factors.
All right, then, Dr. Rath, infertility as a problem, it's not really even seen as a disease in our country. It's just seen as a stigma. It becomes difficult to overcome. Now, there is still a belief that if there is male infertility, it can still be overcome. You can improve on the semen quantity, on the quality. You
Yeah.
see so
So
many hakims and quacks who say, have this, have that, and your sexual life will improve, and fertility will improve. Is there any truth to this? Is male
yeah,
infertility
basically
easier to address?
when we talk about male infertility, there are certain parameters. So now we have to decide in what categorically or we are classifying the male infertility. In the classifications, what we have to know that what is the normal semen count. So there is the WHO count 1992, which is says that it's the 2 ml volume and 20 million counts and 50% of motile sperm. WHO 2010, it is saying that 1.5 ml of volume and 15 million counts of 32% of motility. Anyway, so these are the rough idea. So we have sperm which is above this parameter. So then we know that the sperm is good. When it is coming below that, so obviously, what comes to the count? So the count when it is within 5 to 10 million, obviously it's a or more than 10 million, around below 20 million. It is a oligospermia. It's mild oligospermia or something. When it is very low, it's below 5 million, it's come severe oligospermia. What do you mean by oligospermia? The sperm count is less. Okay, so that is one category where we know that yes, we can get the sperm, we can see the sperm, we can find out how the quality is, how it looks like, so all that thing. Oh, there is one category when there is no sperm outside, that is azospermia. So then question comes whether the sperm is there inside or not. If it is there, in which level that is there, it might be a due to a blockage, the sperm is not coming. It may be due to some hormonal production, which is the sperm is not coming. So you have to find out what is really the reason or the cause, and then identify that and go ahead with this. So when it is a oligospermia or a mild oligospermia, then we have some empirical treatment. We give some medicines depending on the hormonal levels and all. Many of the time the patients improves. If they don't improve also, then we can think of certain easier treatment like IUI and all, when it is count is more than 10 million. But when the count is less than 10 million or more than 5 million, something like that, when you know that the IUI procedure is also not possible, we have to think for other ART procedures like IVF, and below 5 million count, you have to think for a ICSI. So depending on the count and the parameters, we have to decide what really the treatment can be feasible for the person after giving our medical treatment, if it is really possible or it has to be given.
Right. So, Dr. Nath, you've explained the various stages of
Yeah.
or the categories of male infertility. Now, when it comes to female infertility and the inability to conceive, age is a very important parameter. Say if the patient is young, then you can afford to have them try on their own for a longer time, try IUIs and other simpler procedures for a longer time. Uh, because there is no
Very, very,
alarm
very
bell,
well
there is
said.
no
Very
deadline.
well said.
Right.
Very
But
well said. See,
Dr. Nath, is that the case for men as well? Because
yeah,
it is
generally,
usually believed.
Yeah.
It is believed that men are potent even in the 80s. Even in the 80s, they can sire children. So, is age a criteria at all?
For male, the age is not that much criteria as much as it's female, but still in the male above 40 and 45, the sperm production always decreases because there are a lot of other medical conditions that develops. Maybe the hypertension, maybe the diabetes or other things that develop. So automatically the sperm productions decreases. We don't know about the how the sperm DNA changes post 50 in the male. So there obviously the age is also our issue on the male sperm because the DNA damage might happen and motility might have a issues. So the erection problems might come. So all that is the issues for a male above 40 or 45. Yes, is not as much as because as I said, it's very easy for a male to give a sperm. So if they give a sperm couple of times, if I find some of the good looking sperms, I can do wonders because obviously we can do a ICSI and then give you a baby. But obviously the woman, it is very difficult because of the age is a very, very, very significant parameters for them because issue is that the egg quality or the quantity will be completely decreased and all other issues.
All right, Dr. Rath, we've already started getting a few questions, so let's start taking them up. We'll continue with the discussion as well. So one question is coming from a Facebook user who's asking, can physically challenged, which is a paraplegic person, be allowed for availing surrogacy?
Physically challenged?
Yes, the question is a little vague, but I'm assuming that a person is physically challenged and want to understand, can they go for surrogacy because of their physical inability?
Now it is a very strict and very stringent. We are not offering surrogacy in our clinic, so I will not mention about this question because this is a very weird and very, very, very inappropriate question.
All right, right. So let's move on to another question. And one question that is coming from a Facebook user is IVF and ICSI the same treatment? The ICSI and IVF, are they the same treatment?
Okay, very good question. So IVF and the ICSI, the difference between is the basic treatment is the same. It is a lab terminology that is the difference. In the IVF, what we do, we take out the oocytes from the woman and then we put the sperms in the same dish or the well and make the sperm fertilize the egg on their own with their motility. But in ICSI, what happens? The motility is a severe issues for the male factors, maybe because less than 5 million sperm or something like that. So we find out each and every sperm, which is a good looking and the healthy sperm, and then immortalize the sperm and then eject in the eggs so that we fertilize the egg and then the embryos will be formed. So basically it is a lab, the procedure that they go through, the woman has to go through all the injections and then do the ultrasound, all these are same, the egg pickup, all are same. Following that in the lab, it is a different.
Right. So the scientific procedure may be different, but is there a difference in the outcome as well? Would you say that ICSI is more successful than IVF?
The ICSI is always for sure of fertilization. So there is no doubt about it. The fertilization will take place. In IVF, some of the time, there might be some reasons that the fertilization will be failure. Sometimes the zona of the egg will be very thick. The egg wall is difficult to penetrate for the sperm. On its own, it might not be able to penetrate. So there may be a fertilization failure. So in ICSI, really you don't have that issue. So completely it will be fertilized. So naturally the result and the embryo formation will be better.
All right. So ICSI may have a better outcome. Now we have another question coming in from a Facebook user. If a patient has 2 embryos, then how many embryos should be transferred at a single go?
Okay. We generally transfer blastocyst and we transfer blastocyst. We transfer 2 blastocysts, nothing more than that. 10 years back, we used to do transfer of 2 or 3 embryos more or something like that. But now we have stick to a completely 2 embryo transfer. Some of the time, even we have done a single embryo transfer when we know that the embryo quality is very good. It's a very higher age group of patients. We don't want a twins or because our implantation rate is around 45 to 50%, even more than that. So naturally, we some of the time consider a single embryo transfer for a very higher age group woman.
Could you tell us what is the difference between an embryo and a blastocyst?
Okay. So whenever the fertilization takes place, like eggs and the sperm meets, after that it goes in a series of development. So day 1, day 2, day 3. So after the fertilization, that is the embryo. So the embryo develops. So day one, there will be 2 cells. Day two, there will be 4 cells. Day three, there will be 8 cells. So it's a division of the mitosis that's happening. So day 4, it will be 16 cells, and day 5, it is the blastocyst. So when the blastocyst forms, the inner cell mass which is ready to come out and get implant into the uterine cavity. So following which, after which, I will not be able to keep the embryos outside or in a dish or in an incubator. I have to put it inside the womb so that the embryos can develop there and get implant over there.
All right. So you're saying a blastocyst is a older baby than an embryo.
The blastocyst is the final stage till where we can develop the embryo outside.
All right. All right. We have another question coming in from a Facebook user. The user is saying, my AMH is 0.52 and my partner's sperm count is less. So will IVF be the option for us? Can it be done?
Yeah, it can be option, obviously. It depends on the age, because the AMH 0.5 doesn't mean that she has all poor quality eggs. Yeah, it may say that she has a less number of eggs, but she might have a very good quality of eggs. So naturally, if the good quality of eggs are there, because her age is not mentioned, so with the low sperm count also, she can have a baby, and IVF could be the option of choice if she is not conceiving and she is having a higher age group also.
All right, Dr. Rath, related to AMH, we have another question, and this Facebook user is saying that the AMH is fairly low. It's 0.05 and the age is 42. So she's asking, will an IVF procedure work with such low AMH levels and at an advanced stage?
Yeah. In that age group, obviously the AMH of such low, it's going to be very difficult to get her pregnant with her own eggs. So obviously for her, the oocyte donation or egg donation should be the choice to go ahead for the further treatment.
All right. Another question that we have from a user is, what is the success rate of IVF and what is the best season to go for IVF?
Oh, that's a very good question. Okay, the success rate, obviously in our clinic, it is with an egg donation procedure, it's around 70%, yeah, even more than that. With a self-egg cycle, it is around 50 to 55, 60% some of the time. Okay, it all depends on the age of the patient, but overall, this is the success rate. And the timing, yes, in there, I have seen in the last 10, 15 years of my practice that some of the time during the summer time, especially in the June, July, and some of the time, maybe the heat, when it is a heat wave goes on in the May, there is a certain dip in the result. But winter is always the best time to have a very good results. It may be due to the pollution, it may be due to some other thing, maybe the lot of toxins in the air or because of the heat. But we have seen this variation. We had planning for a paper also with so many years of data that we are having every yearly, what the seasonal time, that time we used to have a decrease in the result. But yes, some of the time it is there. In those particular year, I mean month in a year, we find sometimes a decreased success rate.
All right. Dr. Rath, another question has come in. Can PCOD cause infertility?
Yeah, very much it can cause infertility. PCOS is actually a condition of endocrine condition where the ovarian androgen levels are very high. So the follicular development and the maturations are pretty less. So you get a lot of time to get a very immature follicles. So the follicles are not growing. There might not be a good follicle. Many of the time they will not have bleeding. So naturally there will be no ovulation. So when ovulation is not happening, so naturally the pregnancy chances are very less. So overall, the woman will become amenorrheic, she will become obese, she'll have a lot of other metabolic problems. So altogether, yes, it can cause infertility in a severe form.
All right, we've got a related question from another Facebook user. She's saying, I'm 33, I have PCOD issue, 2 IUIs have failed. What are my chances of conceiving with IVF? How do we improve egg quality if somebody has PCOS so that the success rate in IVF is high?
Yeah. So now the basic reason is the age is 33 with 2 IUI failure, and I hope the sperm parameters are perfect. So in that scenario, my suggestion will be the duration of infertility. If the duration of infertility is high or the age of marriage was pretty early, my suggestion is you go for IVF. Because yes, as mentioned, we don't know in the PCOS what is the egg quality and the is it mature, immature and all that. Some conventional gynecologists might think, or some of the people might think, yes, we can go for a laparoscopy as well and then see if she is conceiving within next 3-4 years, 3-4 months. But considering all other factors, IVF can be the treatment of choice, because at least we can see which are the follicles which are immature or mature. Depending on that, we'll know what is the condition of the embryos, and we plan accordingly.
What purpose does a laparoscopy serve if somebody has PCOD? And the question that she has is how to improve the egg quality.
No, you cannot improve your egg quality by any kind of medicines or anything. This is completely your egg quality is whatever you have destined, that will be there. So quality cannot be improved. It's only thing we can find out what is the quality, because once you are going into the IVF, since we are culturing the embryos, see, if we don't know what is there inside and we keep on trying hard that it will conceive, then obviously it doesn't make any sense. In your younger age group, you have got a time, but if you are elderly, 33, 34, 35, obviously your reserve is going to come down, and a lot of other parameters will come into the picture. So that will also jeopardize the whole issue. So basically, if you are not conceiving 33 plus, two issues are there. Either go for a laparoscopy and then see if you conceive after that, after damaging those excess follicles and doing some drilling. And the next choice, if the some sperm has got some parameter where there is some problem, then go for IVF.
All right. Dr. Rath, we have another question from Facebook user who's saying, I am having a little bleeding 10 days after embryo transfer. Is this normal?
Yeah. 8 to 10 days following embryo transfer, a spotting, very minimal bleeding can be done, because it can be implantation bleeding. We have seen very many patients give this kind of complaint. So that is not that your transfer has failed or something like that. It can be due to implantation bleeding. So there is a minimal bleeding. Obviously, a severe bleeding is not expected. Very minimal bleeding can be.
All right. Another question that has come in is, it's a general question. I think a lot of people have this. How to increase fertility? How can you increase your fertility for men and women?
See, basically, there are a lot of issues. Obviously, once you are healthy, your ovaries are very good. You are having regular cycles like every 30 days or 28 days, and your husband's sperm parameters are perfect. You know, all other everything is fine. So generally, if you are having a regular intercourse at least twice a week, not necessary that you have to do it from day 18 to day 18, 8 to 18 of the cycle alternate day, because not all the time that is possible. So if you have a regular intercourse with a regular interval, at least twice a week with a adequate interval in middle, you can have a good result. You can expect that if all other things are fine.
Do lifestyle modifications also?
Yeah, surely. So you have to be very much healthy. Though if you are high weight, obviously that has to be reduced. Your lifestyle has to change. Your sleeping pattern has to be changed. So all other things has to be, the stress has to be out. You should have a very healthy diet, and also the exercise and all other things should be keep it in mind. So keep yourself mentally, physically fit, and all other parameters in the right frame, and keep in the right frame of mind. And obviously the other way that I have mentioned already.
All right. Dr. Rath, we have another question. And the question from a user is, what are treatment options available for Azuspermia?
Yeah. So the Azuspermia, first you have to find out what is the Azuspermia, what kind of Azuspermia it is. So we find out it's some kind of taste and blood test. Sometimes it can be due to a blockage, sometimes it can be due to a hormonal problem. So then we see, sometimes we do a trial TISA, we do ultrasound, and then do a trial TISA, see whether the sperm can be visible. Most of the time, it is with a TISA ICSI that we can get a result. So with a TISA, we might get a sperm, then we fertilize with the eggs and see how many embryos are forming, and accordingly, we can go ahead with the transfer.
All right. Another Facebook user is asking, I am a 38-year-old woman. I had 3 miscarriages in the last 4 years. Each time she had conceived naturally. Do I need to opt for IUI or IVF? In case
age group, can you please repeat?
38 years old for 4
38.
years. Yeah, in the last 4 years, she's had 3 miscarriages, and they were natural conceptions. So if she's having recurrent miscarriage,
recurrent miscarriages, yeah. So basically,
with IUI or IVF, what should she do?
No. Those things will not come into the picture first. The first thing is we have to find out why the hell she is having so many miscarriages. So that the first thing is we have to find out whether she is having any kind of chromosomal abnormality for her or for husband or both the partner. And some of the other tests like diabetes and all other infection screening, everything has to be done. Once we are clear that there is no other organic cause for which the miscarriage is happening, it might be due to a poor egg count or something like that, then we have to think of going further. So then IUI is not going to have a helpful. IVF, yes, with a PGS, that pre-implantation genetic screening, we have to find out the healthy embryos that is there or not, and then think for a transfer that can help her. Or maybe some other program like egg donation program.
So Dr. Rath, could you briefly tell us how can you find out if the chromosomes are fine before we go into any procedure? How do you find out if the chromosomal quality is good?
Yeah, chromosomal, like we have to do a karyotyping. So there are certain indications for which we can go for a karyotyping. So the karyotyping is a blood test that tells us how the chromosome analysis, that is, will tell us if there is any abnormality in the chromosomal pattern or anything in the lady or the husband. So depending on that, some of the cases we know that yes, some balance translocations, yes, some of the other conditions, the woman will not be able to have a baby with her own egg most of the time because there will be a pregnancy failure. So we have to see if PGS can be possible for those patients, or you have to see that we have to go for an egg donation.
All right, but it involves a blood test of both the male and the female.
It can happen the male and the female, yes, very much. I have seen a patient where I'm just giving you the example. The couple had come for a female infertility because she was having a PCO problem, so she was advised for IUI. Husband's sperm was excellent; it was never a problem. So the sperm was very good. So we did not get any pregnancy in IUI. The couple went for a IVF. IVF also patient, husband, wife did not conceive. So first IVF. Then obviously they was thinking that because of the PCO, the poor quality of site and all. So then they said, we don't want to try anything, sir. Must be the egg problem because she had endometriosis, minimal endometriosis, she had PCO. So everyone thought it's of the woman. Then we went for an egg donation also. In egg donation also the pregnancy happened, but again it failed. Then I asked for a karyotyping of the husband, and it came out that he has a major problem in his chromosome. So that may be the reason that patient was not conceiving. So that is how, I mean, it's even in a normal population when the husband's semen is perfectly all right. I found a husband there is no question that we suspect that we have to get a karyotyping done for him. So that can also happen.
No, but if you do the karyotyping, like there is a question of ethics involved. But once the embryo is being made in a petri dish, can some of these imperfections in the chromosomes be overcome?
No. If there is a chromosomal problem, that is common. So what we have to do, we have to find out if that chromosomal pattern, what happens, that we do a PGS, we see that chromosomal problems cannot occur in the offspring. So see the embryos which doesn't have that, those of the embryos can be transferable. You cannot just overcome and change the whole chromosomal pattern with any kind of medications or treatment that yes, this has been reduced or this can be changed. So now that cannot be done.
All right. One last question, Dr. Rath. The patient, the Facebook user is saying that I've had 2 failed IVFs. Is there a possibility of the 3rd attempt being successful?
It all depends her age. Obviously, the IVF which was failed because of what egg quality, poor egg quality, and all that thing. In this case, I will suggest that if suppose I assume that her embryos were good, her uterus was good, everything was fine, still she has failed. So the first thing comes in mind is the implantation potential. So there is a endometrium receptivity array. One test has come, which tells us the time when I should transfer the embryos to her. If the ERA report says that the timing of the transfer was not correct and the timing was some deviated, maybe it is preformed or maybe post receptive. So in that case, she will have an excellent chance of conceiving with the same embryos that has been transferred to her because the timing was not. If the timing says that everything was correct, then maybe the gamete changes will be the result for her if all other parameters are perfect.
All right, Dr. Rath, thank you so much for joining us and answering so many questions that you have. So many of our viewers have benefited from your experience, from your wisdom, and from your advice. Thank you so much for being with us.
Thank you. Thank you. It's very nice. Pleasure.
So that was Dr. Rath answering all your questions on fertility and IVF treatment during COVID-19. Now, if you have more questions, if some of the questions are still left unanswered, you can send them to us. Just click on our WhatsApp button on the Facebook page and Type in your questions, send it to us. We will try to take it up in the subsequent shows. And don't forget to follow us and stay updated on all that concerns your health and well-being. This program is supported by Bharat Serums and Vaccines under its public awareness initiative. We'll be back with our special show on women's health care next week in the evening at 5 p.m. Do follow us on Facebook to get all the updates on our upcoming shows. Keep sending us your questions and we will certainly include them in our next show. Till then, stay at home, take care, and stay safe. Goodbye and see you soon.